Hello, and thank you for the opportunity to present our work at the AI in Infectious Disease workshop. I am Sylvain Meylan. I'm an ID specialist, and together with Jeremie Despraz, who's a principal data scientist, we will be presenting an artificial intelligence-powered learning health system to improve sepsis detection and care. Sepsis is a syndrome defined by a dysregulated response to an infection. Rapid recognition and management are key to an improving outcome. Back in 2019, our hospital was confronted with a reported increase in mortality for sepsis cases with an odds of ratio of 1.6 compared to other university hospital centers in Switzerland. And in response, the directorate launched a sepsis care program to address this. So we constructed a clinical care pathway, but from the get-go, we wanted to be quantitative in our approach. Arguably, clinical teams are better convinced by data than by simple recommendations. So we wished to have teams continuously informed by the consequences of their practice. So what we aimed for was to build a sepsis learning health system. In brief, we wished to translate clinical practice into data, to convert data into knowledge, this is where the AI part comes in, and to feed back this knowledge to stakeholders so as to inform their clinical practice.
So more concretely, our learning health system relies on different elements that we have detailed on that slide. So we have created an automated data pipeline that collects routine patient clinical data from a centralized data warehouse. It cleans it, transforms it, and stores it into a dedicated registry. This data is then enriched with an AI-based module that we have called Heracles that computes relevant clinical quality of care indicators. These indicators are then made available to the clinical teams and the management teams and allows them to identify potential issues and opportunities in the way sepsis is managed in the different wards. These actions directly benefit the patient, closing the virtuous circle back to the patient and to the data collecting stage. We see here a more detailed representation of our Heracles sepsis prediction module. It consists of two machine learning models, a random forest and a long short-term memory that are fed data directly from the registry. These model predictions are then aggregated into a final layer that computes a sepsis probability at regular interval during the hospital stay and for every single patient. The prediction can then be used to compute sepsis-related quality of care indicators. And as time passes, since the progressive deployment of the learning health system, we continuously collect new sepsis label and improve the performance of our models. And that's what you can see here. Here you see a representation of the performance of the model from the first deployment up to the end of 2024. And what you can see is that we reach already a score of about 0.7 in terms of F1 score for the end of 2024. And now I wanted to show you an overview of the dashboarding system that displays relevant quality of care indicators related to sepsis quality of care for the healthcare managers and the clinicians. So it displays general information about the hospitalized patients like sex, age, wards, mortality, etc. But in particular, it can measure the impact of the sepsis program by comparing patients that were treated according to the guidelines versus the one that were not. And for these two groups, we can compare critical outcomes such as time to antibiotics and mortality. Importantly, the dashboard is also highly customizable, so you can easily choose specific time periods for which you want to review these indicators, or you can select specific wards or services that you would want to see. And finally, the system also allows to review individual patient stays. So the user is able to select a specific patient, look at the sepsis probability and the evolution over the stay, and look at specific indicators like vitals or mortality and the pathway across the hospital for these specific patients.
So After its construction in 2019 up to 2021, we progressively deployed the learning health system throughout 2022, which is illustrated down here. What you see is we started with pilots in the medical wards with a full rollout as of late 2022, and we extended to the gastrointestinal surgery and finally the emergency medical department. And one of the first takeaways that we could see is this clear uptick in sepsis codes during the hospitalization, almost a doubling of reported cases coincident with the deployment of our program. Now, however, when looking at Heracles, we had very much a stable caseload of predicted caseload of sepsis throughout the year. And this makes us much more as an improvement of reporting rather than an increase in cases. Second, when focusing on these stays where Heracles predicted a sepsis case, we saw concomitant to 2022 and the start of the deployment, a drop in hospital mortality. This is compared to control wards, where there was, if anything, a slight increase in mortality. Despite the funding stop as of late 2023, we have mostly maintained our effect, meaning that our learning health system is at least in part self-sustainable. So now, beyond consolidating our sepsis learning health system, we're eager to see whether we can share this tool with other Swiss university centers. And so what we're doing is teaming up with the Swiss Data Science Center and the Insel Hospital in Bern and the Kinderspital in Zurich to see whether our pipeline can be implemented in other hospitals and whether it can have its effect also in other hospitals. But more generally, we see this pipeline more as an operating system on which we will build not only this phenotyping and outcome analysis tool, but many other clinical decision support tools that could improve sepsis care. And we're thinking of predictive sepsis, prospective prediction of sepsis. We have a project here in neonatal medicine, stewardship advisor for the antibiotics prescription, assisted prescription, in the case predicting kidney failure and such things. And finally, endotype guided personalized medicine as a next step also in sepsis care. So of course, we want to end by thanking a lot of people who have made this possible, both in CHUV and at the Swiss Data Science Center. This list is not exhaustive, and we apologize to all the many others that have brought this forth and whom we couldn't put on this thank you slide. Thank you very much.